This community update is available on Facebook in Spanish. This community update is available in Spanish on Facebook, and you can find that on Facebook at BCHHS. Today's updates will be provided by Stacy Saunders, Buncombe County Public Health Director, and Fletcher Tove, Public Health Preparedness Director. And we'll go ahead and get started with Stacy Saunders.
Good afternoon and welcome to the community briefing. As of today, there have been 2,565 lab-confirmed cases of COVID-19 in Buncombe County residents. Our community has administered 58,851 COVID-19 tests. Sadly, we as a community have experienced 72 COVID-related deaths. The vast majority of these deaths are associated with long-term care facility outbreaks. Recent percent positivity published on the North Carolina COVID dashboard shows 7.6% of COVID-19 tests performed are coming back positive in our state. This percentage for the state has been hovering around 8% for the last few weeks. Our current percent positivity in Buncombe County is 3.5%. We are currently seeing about 20 new cases per day on average. This is a drop from 40 new cases per day back in July. Our metrics continue to move in the right direction. We as a community have worked hard to reduce transmission by committing to the 3 W's: wear, wait, and wash, and limiting our interactions. Let me be clear, the 3 W's are critical as we move into phase 2.5. As more restrictions are lifted and we find ourselves moving around a bit more, it is so very important to remember to wear your face covering, wash your hands often, and wait 6 feet apart, keeping distance between each other. Fletcher Tove will be talking to you more about phase 2.5 in just a few moments. I want to remind everyone that if you are showing symptoms of COVID-19 or think you might have been exposed to COVID-19 regardless of symptoms, we want you to get tested. If you are someone who lives in a high-risk setting like a homeless shelter or migrant farm worker camps, and you think you've been exposed, we want you to get tested. If you are someone over 65 or you are someone of any age with underlying health conditions and you think you've been exposed, we want you to get tested. And if you work in places where it's hard to maintain 6 feet of distance and you think you've been exposed, you guessed it, we want you to get tested. Because COVID-19 is highly transmissible and can be spread by people who do not know they have it, testing is important for people who have symptoms and for people who are at higher risk for being exposed to COVID-19. The goal of testing and tracing and isolating is to keep COVID-19 from spreading throughout our community. Quickly identifying those with illness helps us slow the spread of virus in our community. If you are interested in testing, there are several options in our community. If you do not have a healthcare provider who offers testing for COVID-19 and you meet criteria for testing, you can use the state's Find My Testing Site website to find COVID testing near you. There are many places in our county offering testing for COVID-19, including primary care providers, community health centers, urgent cares, hospitals, and pharmacies. The North Carolina Department of Health and Human Services launched the North Carolina Medicaid Optional COVID-19 testing program yesterday. This will reimburse Medicaid providers for costs associated with COVID-19 testing of people without insurance. This new program allows community providers to offer cost-free testing to uninsured North Carolinians. It's a step to increasing access to testing as well as decreasing barriers to testing. Per the North Carolina Department of Health and Human Services, to qualify for the program's testing coverage, people must meet 3 criteria. 1, live in North Carolina. 2, not be eligible for or enrolled in Medicaid or have other health insurance. And 3, hold U.S. citizenship or other legal immigration status as mandated by federal regulations. The reimbursement program will continue during the duration of the COVID-19 federal declaration of emergency. You can also schedule an appointment at one of our county COVID-19 community testing sites. Go to Buncombe County Self-Checker online or over the phone to make sure you should be tested. The Buncombe County Self-Checker can be found online at buncombeready.org. You can also complete the self-checker over the phone by calling the Ready team at 828-419-0095 from 8:30 a.m. to 5 p.m. Monday through Friday. Once you complete the self-checker online or over the phone and your answers indicate that you should be tested, you will fill out a registration form. Once the registration form is complete and submitted, a representative from the Ready team will contact you over the phone to schedule a date and time for testing. Once you have your scheduled appointment, all you have to do is show up at the testing site on your scheduled date and time and get tested. Remember, cost is not a barrier to testing at our community testing sites. There is no out-of-pocket cost to the testing. If you have insurance, it will be billed to cover the cost of the test, and Spanish medical interpreters will be at the testing sites. And a reminder, regardless of your citizenship status, testing is available through our community testing sites. Our community testing sites are normally available on Sundays at AB Tech, Tuesdays at the Ingalls in Swannanoa, and Thursdays at the Buncombe County Sports Park. But I do want to remind everyone that the community testing sites on Sunday, September 6th and Tuesday, September 8th are canceled due to the Labor Day holiday. If you need testing during this time, please visit Find My Testing Site for other community options. More information about COVID-19 testing in Buncombe County can be found at buncombeready.org. Our metrics are showing signs that Buncombe County is committed to stopping the spread of COVID-19. This is a sign of a solid community that looks to do what it needs to meet the challenges of this complex and serious pandemic. This year, Labor Day will be a time to honor our community's dedicated and resilient workforce who have helped our community stay strong during COVID-19. They have educated children, cared for the sick, and continue to ensure that we have the necessities of daily life, and so much more. Let's honor their hard work by continuing to commit to slowing the spread of COVID-19 by practicing the 3 W's. Protecting yourself protects others. Thank you for your hard work and efforts so far. Keep it up. We are in this together. One Buncombe, working together with each other and for each other. Now I'll turn it over to Fletcher Tove, Public Health Preparedness Director, for an update.
Good afternoon. My name is Fletch Tove, Buncombe County Public Health Emergency Preparedness Director. Earlier this week, Governor Cooper issued Executive Order number 163, which will take the state into reopening phase 2.5 on Friday at 5 p.m. The governor based this decision on a combination of positive data trends and metrics across the state. Buncombe County is also observing these same positive trends and metrics locally and will therefore be fully aligning with Executive Order number 163. I'm now going to address the key elements that make phase 2.5 different from phase 2. For our highest risk population, those with certain existing medical conditions or over the age of 65, they are still recommended to follow the safer at home guidelines. Mass gathering guidelines have changed and will now allow for groups of up to 25 people to meet indoors and 50 to meet outdoors, provided that they can still maintain 6 feet of distance between persons. I really want to emphasize that these new mass gathering limitations still require 6 feet of spacing between parties and the use of face coverings and enhanced hygiene and sanitation practices. If you do not have the square footage and space available to give 25 people their 6-foot bubbles, you must reduce your group size to whatever number can accommodate that physical distancing requirement. Speaking of our wear, wait, and wash requirements, per Executive Order number 163, children ages 5 and up are required to wear a face covering in any situation where a face covering is stipulated by the Executive Order. Also of note, as of Executive Order number 163, face shields no longer meet the definition of an approved face covering. Continuing on, museums are now allowed to be open up to 50% capacity, and playgrounds are now also open to the public. Gyms and other fitness facilities, such as yoga, dance, and martial arts studios, are now allowed to open to 30% of their stated fire capacity. This new maximum occupancy must be posted conspicuously at the entrance to the facility. This 30% occupancy is again dependent on being able to maintain 6 feet distance between persons. If 6 feet of distancing cannot be maintained, the maximum occupancy must be reduced to achieve that required spacing. This 6-foot interval also applies to the distance on persons who are sitting at a workout machine, so that they will either need to spread those machines apart or restrict their use to maintain the required spacing. Customers and staffs of a gym must wear face coverings unless strenuously exercising. The definition of strenuous exercise will be applied at an individual level and will be determined by the customer and the facility staff. All equipment must be disinfected between every use with an EPA-approved disinfectant for COVID-19. If gyms are asking customers to disinfect a station after use, they must post instructions on the proper method and specific sitting times for that specific disinfectant they are using. Movie theaters, bars, pool halls, and nightclubs and music halls remain closed. In addition, tour buses and other sightseeing transportation conducted for the purpose of amusement are also ordered closed. Governor Cooper was able to take us to phase 2.5 because our data trends support it. Those trends are a result of all of us taking public health guidance seriously and doing our best to protect our loved ones, our neighbors, and our communities. Let's continue to put forth our best efforts to stop the spread of COVID-19 in Buncombe County. As always, let's stay safe, let's stay smart, and let's take this step by step. Thank you.
Thank you for joining us today. As a reminder, the deadline to complete the census is quickly approaching, so we encourage you to go on Buncombe County's webpage and find out more information about how to take the census, or you can go to 2020census.gov and fill out the census online. We will be back next Thursday at 3 p.m. with next week's community update. Stay safe over the long weekend.